Varicose veins are extremely common, affecting nearly half the population aged 50 and older. Risk factors include older age, a family history of vein problems, hormonal changes, obesity, and prolonged standing. Diabetes, whether the younger onset type 1 or the older onset type 2, can produce some direct skin changes and over time has an effect on both the larger arteries and smaller vessels. The changes can result in nerve numbness, wounds that may not heal efficiently, and infections. If you have varicose veins and diabetes, it's even more important to get them checked and treated at an early stage. Dr. Charlie Hahn of Veins, Florida explains some of the different treatments available.
For the vein treatment, a lot of patients think it's not medical problems, but I think I see a variety of complaints, and we have a variety of treatments for the vein patients. It's, traditionally medicine, patient come in with one set of problem or several sets of problem, and then you will usually, you can either treat the patient or refer the patient somewhere else. For the vein patients, they tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. Varicose veins can cause blood clots in them, and then they cause a tremendous amount of pain once the blood in them become clots. And we call the thrombophlebitis. And also, the larger it gets, they tend to pull more blood, which cause skin changes, color changes around these large varicose veins. It can cause skin ulcers, which will take a very long time to heal. And also they can cause a large amount of bleeding if they got injured. Genetic plays a very large role. Usually you tend to notice the leg feel heavy, and there's a lot of swelling. And sometimes patient can have fatigue. The potential dangerous is when you start noticing and your leg get really swollen, especially around the ankle and the lower part of the leg. And also they tend to ache. Also you notice some skin changes. Instead of nice looking skin, they tend to be kind of rusty looking and start having small ulcers. And those are the warning signs. The procedure very minimally invasive. We have our own surgery center. Patient come here, they will have some sedation. We localize the vein and access the vein with the ultrasound help. And then the device is very thin. It's like a hair. It will place into the vein and the laser will work. It usually takes about 5 minutes. And then I will remove the device and perform either injection or clean up the varicose veins with microflebectomy. And usually about 20-30 minutes. And then the patient will have a dressing, wake up from surgery, and they've been watched for about an hour or so, and then they can go home after that. I tend to tell the patient what they expect. I mean, unfortunately, we don't have a magical method, just to make all the legs smooth, make every little varicose veins go away. It's just about expectation of this thing.
If you'd like contact information for Veins, Florida, just click the Diabetic Dilemma story link icon on our homepage at yourhometownhealth.com.